Medical racism in the United States is not just a dark chapter. It's a deeply rooted system that used black bodies without consent, often without anesthesia, and always without justice. From slavery through the 20th century, black people were regularly subjected to unethical medical experiments that white society justified through false beliefs about black inferiority, insensitivity to pain, and expendability. One of the most well-known cases is the Tuskegee syphilis study, which began in 1932. The U.S. Public Health Service promised free medical care to 600 poor black men in Alabama, 399 of whom had syphilis. The government lied to them, withholding treatment even after penicillin was proven effective in the 1940s. For 40 years, these men were observed as their bodies deteriorated. Some went blind, insane, or died, and the disease was passed to wives and children. This wasn't a mistake. It was a strategy. The goal was to study how syphilis ravaged the black body without intervention. But Tuskegee wasn't the first. During slavery, medical schools relied heavily on the bodies of enslaved black people, both living and dead, for dissection and experimentation. Dr. J. Marion Sims, often called the father of modern gynecology, conducted surgeries on enslaved black women without anesthesia, believing that black women didn't feel pain the same as white women. He experimented on a woman named Anarcha over 30 times. These women were not patients, they were property. In the 20th century, black children were also experimented on. At Holmesburg Prison in Philadelphia, mostly black inmates were used for dermatological and chemical experiments without proper consent. In the South, black children were used in radiation studies, while black women were often sterilized without their knowledge, a practice known as Mississippi appendectomies. In some cases, government-funded hospitals performed unnecessary surgeries on poor black women under the guise of birth control or disease prevention. Even into the modern era, disparities continue. Black patients are less likely to receive pain medication in emergency rooms, more likely to be misdiagnosed, and still face medical neglect rooted in centuries of false racial science. These historical practices weren't isolated. They shaped the institutional distrust many black Americans have toward the healthcare system today.